Welcome to this lecture on the integumentary system. This content is designed for paramedic prep students to learn the concepts of the anatomy and physiology of the integumentary system. First, let's review the objectives for this lesson. By the end of this lesson, you should be able to state the functions of the integumentary system, name the layers of the skin, name the tissues that make up the subcutaneous layer and describe their functions, describe the functions of the 5 levels of the epidermis, describe the function of melanin, melanocytes, keratin, and keratinocytes. Describe how the blood vessels in the dermis respond to heat, cold, and stress. Describe the function of hair and how it grows. Explain how sweat glands play a role in regulating body temperature. And describe the structure of the nails. The integumentary system is the largest organ of the body. It accounts for about 15% of an adult's total body weight. The system itself includes the skin, but also several accessory components, like the nails, hair, sweat glands, and oil glands. While the integumentary system has many functions, the primary functions include temperature regulation, maintaining homeostasis, serving as the first line of defense against infection, and regulating fluid balance. We will spend some time reviewing these functions in greater detail throughout this presentation. Let's talk about the skin layers and structure. Skin thickness varies across the body, being thickest in areas subject to wear and abrasion, like the palms of the hands and soles of the feet, and is thinnest on the eyelids and the eardrums. The skin is composed mostly of 2 main layers, the outermost layer, called the epidermis, and the innermost layer, called the dermis. Below the dermis lies the hypodermis, or the subcutaneous layer, which supports both the dermis and epidermis. While it's generally not thought of specifically as a layer, we include it here to help provide a framework for future discussion. Let's break down each of these layers. Starting first with the outermost layer, the epidermis. The epidermis is made up of stratified squamous epithelium that serves as a boundary for protection. This layer does not contain any blood vessels, but instead, the deepest layer of the epidermis receives blood supply from the dermis. The primary functions of the epidermis is to provide protection against outside pathogens, protect against ultraviolet radiation from things like the sun, and prevent excessive water loss. Cells in this layer divide and grow, moving toward the skin surface away from the dermis layer below. As cells move upward, they receive less nutrients and eventually die. Older cells are called keratinocytes, which harden with age in a process known as keratinization. Keratinocytes are the most abundant cells in the epidermis. They produce keratin, a protein that's essential for strength of hair and nails, which fills the cytoplasm of these skin cells. Once filled, they collectively form the stratum corneum layer, one of the 5 layers of the epidermis. Dead skin cells in this layer are eventually shredded from the body. Keratinocytes also contribute to immune functions by stimulating T lymphocyte development and play a crucial role in skin repair and regeneration. The epidermis also contains several specialized cells. Keratinocytes produce keratin and support immune functions. Stem cells are undifferentiated cells that generate into new keratinocytes. They push existing cells closer to the surface. Dendritic cells activate the immune response. They're produced in the bone marrow and travel to areas susceptible to toxins and pathogens. Melanocytes produce melanin, which absorbs and blocks UV light. And lastly, the tactile cells. These are associated with nerve fibers in the dermis that act as touch receptors. A tactile disc is the same as a tactile cell and a nerve fiber together. All of these cells work together to protect and maintain the integrity of the epidermis that consists of 5 layers: the stratum corneum, the stratum lucidum, the stratum granulosum, the stratum spinosum, and the stratum germinativum, or stratum basale. Let's talk about these individually. The stratum germinativum, or the stratum basale, starting from the deepest layer. This is the innermost layer of the epidermis. It forms the epidermal ridges that interlock with the dermis, creating our fingerprints. We'll talk more about fingerprints once we get through all 5 of these layers. This layer also contains stem cells that continuously divide and replace cells that are lost through shedding at the surface. The stratum spinosum, also known as the spiny layer, consists of 8 to 10 layers of keratinocytes bound by desmosomes. Desmosomes are specialized cell structures that are used for cell-to-cell adhesion. The name spiny layer comes from the appearance of this layer. The cells look like tiny pincushions because of exposure to chemicals that cause these cells to shrink. This layer also contains Langerhans cells, which stimulate and play a role in the immune response. Known as the grainy layer, the stratum granulosum is composed of 3 to 5 layers of keratinocytes. Here, cells stop dividing and begin producing keratin and caterohyaline, which contribute to the skin's strength and waterproofing properties. Keratin is the tough, fibrous protein that is a key structure material that makes up hair, nails, and the outer layers of the skin. Caterohyaline is a protein structure that helps form tight barriers by cross-linking keratin filaments. This process is called keratinization, and this helps form a barrier to protect the body from foreign particles. The stratum lucidum is a thin, translucent layer found only in thick skin, such as the palms of the hands and the soles of the feet. It contains densely packed, dead keratinocytes filled with elodine, a protein that eventually converts to keratin in the stratum corneum. Elodine is best thought of as the stage in the process of keratinization. Lastly, the outermost layer, the stratum corneum, consists of 15 to 30 layers of keratinized cells, providing a tough protective barrier. These cells are interconnected by desmosomes, ensuring durability. Remember, desmosomes are specialized cell structures used for cell-to-cell adhesion, or the ability for the cells to stick together. This layer is water resistant, though not waterproof, and contributes to preventing water loss through evaporation. The body loses up to 500 milliliters a day of evaporated water. So how are fingerprints formed? Fingerprints are formed during fetal development, when the basal layer of the skin grows faster than the layers above it, which cause the skin to buckle and fold into ridges. They are formed by the dermal papilla in the papillary layer of the dermis. More on this in a little later. During weeks 6 to 7 of fetal development, thick pads called volar pads form on the palms and feet. The size and orientation of these pads is genetic and determines the main pattern of a fingerprint. Around week 12 of gestation, cells in the basal layer grow faster than the other layers, causing the skin to buckle and form ridges. Waves of ridges form on the fingertip, spread, and collide with each other, creating unique whorls, arches, and loops of a fingerprint. Between weeks 17 and 19 of gestation, a new layer of keratin coats the skin, and smaller ridges form from uneven keratin growth. Each fingerprint pattern is unique and remains constant throughout life. As a result, fingerprints are commonly used in criminal cases to identify people. Now let's talk about the second, more deeper layer of the skin, known as the dermis. The dermis lies beneath the epidermis and is composed of dense connective tissue, which provides strength and elasticity. It houses sensory receptors, blood vessels, sweat glands, and it supports the epidermal function by enabling sensation and thermal regulation. The dermis consists of two layers, the superficial papillary layer and the deep reticular layer. The superficial papillary layer consists of areolar tissue, also known as loose connective tissue, that connects supporting organs and tissues, and it contains capillaries and sensory neurons. The name comes from the dermal papilla that project between the epidermal ridges, which we just talked about as they relate to fingerprints. The deep layer, known as the deeper reticular layer, comprises a meshwork of connective tissue that contains collagen. Collagen is an important protein building block, and it also contains elastic fibers. So the connective tissue contains collagen and elastic fibers. This allows the dermis to be both tough and have elasticity. It contains nerves for sensation and blood vessels for thermal regulation. Now let's talk about the makeup of the dermis. The dermal layer, as previously mentioned, contains collagen and elastic fibers that make it both tough and elastic. Processes from nerve cells are located throughout the dermis. Motor processes carry impulses to the dermal glands and muscles, while sensory processes carry impulses back to the brain and the spinal cord. The blood vessels of the dermis play an important role in the body's response to touch, hot, cold, and pain by vasoconstricting or vasodilating in response to stimulation from the autonomic nervous system, aka the sympathetic and parasympathetic nervous system. So where does tattoo ink go? You guessed it. When getting a tattoo, ink is injected into the dermis layer of the skin, where it remains trapped in fibroblasts, and these are cells that create and maintain connective tissue. This allows the ink to remain visible and relatively permanent because the dermis provides a stable environment for the pigment particles to settle within its connective tissue, unlike the outer dermis, which sheds regularly. While not technically a layer of the skin, the hypodermis, or subcutaneous layer, is a layer of fat and connective tissue that insulates the body, stores energy, and provides a cushion. The subcutaneous layer lies between the dermis and the various underlying organs. This area of the body serves as the primary site for subcutaneous injections, although not widely used in EMS anymore. Most injections are intramuscular, if not intravenous or intraosseous. Now let's dive a little deeper into those primary functions of this system. Earlier, we mentioned that the skin has several innate functions. It provides physical protection, immunity, wound healing, a site for vitamin D synthesis, thermoregulation and fluid balance, and sensation. Let's break these up apart. As far as physical protection goes, skin acts as a physical barrier against mechanical trauma, pathogens, and environmental factors. The epidermis can withstand normal superficial wear and tear. The dermis provides the epidermis with blood supply, which is why you still bleed when you have a superficial cut. The hypodermis provides more cushioning to any mechanical trauma the body encounters, particularly through the copious amounts of adipose tissue, otherwise known as fat tissue. The nails and hair also contribute to this protection, which we'll review in more detail shortly as part of the accessory components of the integumentary system. As previously mentioned, the skin serves as an anatomical barrier against foreign invaders. Cells are connected through tight junctions that help with the reinforcement of the keratin filaments, which provide the barrier. Antimicrobial peptides, or AMPs, and lipids on the skin also act as a biomolecular barrier that disrupts the membranes of certain bacteria. Lastly, an additional aspect of the skin's immunity lies with the resident immune cells. These cells, known as myeloid and lymphoid cells and Langerhans cells, possess the ability to travel to the periphery and activate the greater immune response, which includes inflammation. Another primary function of this system is the ability to heal wounds. Wound healing occurs in a series of overlapping phases. We have homeostasis, or blood clotting, inflammation, or wound cleaning, proliferation, or tissue growth, and maturation, or remodeling, which is scar formation. This table on the screen uses an analogy of repairing a home to help understand each overlapping phase. So starting with phase 1, homeostasis. That happens immediately post-injury, and it involves platelets that help clot and release growth factors. The analogy is, think of a cap that is broken off one of the utilities. What happens immediately? The next phase is inflammation, and this happens between 1 and 4 days post-injury. These involve our white blood cells, our neutrophils, macrophages, and monocytes, our body's army to go and attack the problem. And the function is phagocytosis. Let's try to eat and get rid of all bad bacteria. And these are the unskilled laborers that are there to clean the site. The third phase is proliferation, and this happens starting around day 4 up to the 3rd week post-injury. And these uses several different types of cells, white blood cells and bone cells, keratinocytes, and epithelial cells. And the function is to fill the defect, reestablish skin function, and close the wound. Think of these as the specific contractors or supervisors of the different utilities that are coming to handle their specific task. And lastly, remodeling happens after about 3 weeks and can last up to 2 years. And these use fibrocytes and fibroblasts, which help develop tensile strength, and they build the scar tissue that's there. And this is where the remodelers would come in and just make sure things are set and things are done to the needs of the person who owns the home. Another key function of the integumentary system is the synthesis of vitamin D. The primary source of vitamin D comes from sun exposure and oral intake, like vitamin D supplements, and certain foods. With ultraviolet sun exposure, 7-dehydrocholesterol, also known as pre-vitamin D, is converted into pro-vitamin D, and subsequently into cholecalciferol, or vitamin D3. Vitamin D3 enters the blood vessels of the dermis and then the bloodstream, where it's then metabolized by the liver, converting vitamin D3 to calcidiol. Calcidiol is then converted to calcitriol by the kidneys, which is the active form of vitamin D. Vitamin D is essential for healthy bones and immunity, and it's also linked to a reduced risk of cancer. Another function is the ability for the system to thermoregulate and maintain fluid balance. With the skin's large surface area that is highly vascular, the skin is able to conserve and release heat through vasoconstriction and vasodilation, respectively. When body temperature rises, blood vessels dilate to increase blood flow and maximize dissipation of heat. In conjunction, the evaporation of sweat that is secreted by certain glands of the integumentary system allow for greater heat loss. When body temperature lowers, blood vessels constrict to reduce heat loss. The hair on the body also affects the regulation of body temperature, as erect hair can trap a layer of heat close to the skin. The last function we'll review is sensation. Sensory nerves in the dermis innervate the epidermis, which is a highly sensitive in the hands, feet, and the lips. These nerves detect touch, pressure, pain, and temperature. The two types of sensory nerves are known as the Meissner corpuscle and the Pacinian corpuscle. These are both considered mechanoreceptors that detect different types of touch and vibrations. The Meissner's corpuscles are elongated receptors found in the palms, fingertips, and soles of the feet. They are the most common in smooth, hairless skin and the best for detecting low-frequency vibrations and pressure. The Pacinian corpuscles are large nerve endings located in the deep dermal layer and the hypodermis. They are responsible for detecting high-frequency vibrations and fine surface textures. These are also found in the interosseous membranes, which may help them detect vibrations in the skeleton. When these nerves don't function properly, patients may complain of things like numbness, tingling, paresthesia, or even a burning sensation. How is skin color determined? Layers of pigment in the epidermis protect both the epidermal and dermal tissues. Hemoglobin, a red color from the red pigment, is found in red blood cells. Typically, areas that are more red, like the lips and the cheeks, often have blood vessels closer to the skin surface, hence why those areas are more red. Carotene is a yellowish pigment found in the stratum corneum and the dermis. Carotene can be obtained from eating certain foods that contain an orange or yellow color. The palms and soles tend to be lighted due to increased amounts of carotene. And lastly, melanin, which is brown or yellow-brown or black pigment produced by melanocytes located in the stratum basale or germinativum. Melanin absorbs UV radiation from sunlight, protecting the epidermis and dermis from its harmful effects. Skin color is determined by all three pigments of melanin, carotene, and hemoglobin. People who have different skin colors have the same number of melanocytes proportioned to body sites. Darker skin races produce more melanin and is more spread out in the cells. Caucasian or lighter skin races produce relatively little melanin, but produce more pheomelanin, which is more reddish or brown, which has more reddish or yellow hue. Now that we've laid the foundation for the largest external organ, let's talk about some of the accessory structures of the integumentary system, which include hair, nails, and glands. All of these accessory structures play a role in protection, sensation, and hemostasis. Hair is a thread-like, keratin-containing appendage of the outer layer of the skin. Hairs project above the surface of the skin over most of the body, except for the sides and soles of the feet, palms of the hands, sides of the fingers and toes, the lips, and part of the external genitalia. There are about 2.5 million hairs on the human body. Over 75% of hair is over body surfaces, excluding the head. Hair follicles extend from the skin surface into the dermis, containing hair roots that are nourished with dermal blood. Each hair follicle is attached to an erector pili muscle, which helps the hair shaft to stand on end when it contracts. Hairs are pushed upward as epidermal hair cells divide and grow, becoming keratinized and then dying. Hair shafts are usually composed of dead epidermal cells. The erector pili muscle is a small muscle that contracts to generate heat and causes goosebumps. This occurs mostly during emotional upset and cold temperatures. It has limited functionality in humans. Hair color is determined by the type and amount of melanin produced by melanocytes, influenced by genetics and environmental factors. The darker the hair, the more eumelanin it has. The lighter the hair, the more pheomelanin it has. This is very similar to how skin color works and how skin color is determined. Those with albinism have white hair because their hair shafts lack eumelanin. The next accessory structure are nails. Nails protect the tips of fingers and toes and are comprised of hardened keratin from the epidermis. Nails contain a root, a body, and a free edge. The root fits into the groove of the skin known as the cuticle and is closely molded to the skin of the finger or toe with the nail fold overlying the root. The body of the nail lies over the nail bed. The part of the nail plate that grows most actively is covered by a whitish half-moon shaped lanula, where epithelial cells divide and become keratinized. As the stratum basale of the root proliferates, nails grow longer. The nail on the thumb grows the slowest, while the nail on the middle finger grows the fastest. The last of the accessory structures are the glands. The glands form from the epidermis that grow inwards into the dermis. The integumentary system includes 4 glands: the sebaceous glands, sudoriferous glands, ceruminous glands, and mammary glands, each with specialized functions. Sebaceous glands are sweat glands are 2 types of exocrine glands in the skin. Sebaceous glands or oil glands are made up of specialized epidermal cells that are primarily located near the hair follicles. They are actually holocrine glands that secrete sebum, which is an oily mixture of fatty material and debris from cells. These are especially abundant in the scalp, face, nose, mouth, and ears. Generally, sebum is excreted into hair follicles, but in some places it is secreted onto the skin's surface. And these oils help the hair and skin retain body heat and prevent evaporation of sweat. Sudoriferous glands are known as sweat glands, which can be broken up into 2 categories: apocrine sweat glands and eccrine sweat glands. Apocrine sweat glands are found in the axilla and groin that produce a milky protein-rich sweat, whereas eccrine sweat glands produce serous fluid, which is watery, to aid in thermal regulation, that are found all throughout the body. Ceruminous glands are a type of modified sweat gland in the ear that produce cerumen, or a component of earwax. These are found in the external auditory canal and designed to keep foreign particles and insects out of the auditory canal. They also have antimicrobial properties, which is why it's important that cerumen exists in the ear canal and that all of it should not be removed. Lastly, the final type of glands are mammary glands, another type of modified sweat gland. These are highly evolved and specialized organs that are present in pairs, one on each side of the anterior chest. The primary function of these glands is to secrete milk for a newborn baby. These glands are made up of fat, connective tissue, and glandular tissue that produces the milk. While these are well developed in females, they're actually rudimentary in males. And that brings us to the end of this core content on the integumentary system. Please don't hesitate to reach out if you have any questions.